Today we will discuss what are the symptoms of depression, how prevalent depression is, what are the causes and risk factors for depression. My name is Dr. Kadir. I am a board certified psychiatrist in the state of California. Let's talk about statistics in USA. 7.1% of US adults have at least one major depressive episode. Prevalence of major depressive disorder is 8.7% in adult females and 5.3% among males. 35% with major depressive disorder unfortunately does not receive any treatment. It is the 10th leading cause of death in United States. Close to 800,000 people die of suicide every year in the world. In US alone, 47,000 people die by suicide each year. Suicide is the second leading cause of death in 15 to 29 years of age. What is the definition of depression? And we are talking about major depressive disorder. People with major depressive disorder have at least 2 weeks of symptoms where they have depressed mood and loss of interest. And then they have to have 5 other symptoms out of these symptoms. The first one is feeling guilty, lack of energy. They don't want to do anything. They used to have good energy, but now even small things are difficult to do. Concentration problem, they have problems reading, writing, problems at work, and problems doing day-to-day chore because of the focus problem. They have appetite disturbance. They either eat a lot or they don't want to eat. Even food does not taste that good. They have psychomotor changes. Either they feel very restless, fidgety, and or they don't have any energy to do anything. Even when they are walking very slow. They have sleep problems. Either they have problem going to sleep, they are waking up a lot, and even when they are waking up in the morning, they don't feel fresh. They also have thoughts of death or suicide. What are the cause of depression? There are many theories, but the main and the more stronger one is the neurotransmitter imbalance. We have serotonin, norepinephrine, and dopamine in our brain, and with depression we have depletion of serotonin, norepinephrine, and dopamine, and that's what causes depression. What are the risk factors? There are many risk factors. Genetics is also one of the main or leading risk factors. Depression runs in the family. People with medical problem can also have depression, like people with thyroid problem. If they have hyperthyroidism, they are more prone to feeling anxious. With hypothyroidism, they are more prone to develop depression. Chronic pain itself can cause depression. Heart problems also cause depression. I've seen a lot of people who have a heart attack and after that they develop depression. Low folate or low vitamin B12 also can cause depression. Low vitamin D also can cause depression. Even certain medications like pain medication or corticosteroids medication can cause depression. When it comes to medical problems, it's always better that a person should rule medical problems before they start any medication for depression, because sometimes when you treat medical problems, depression itself can go away. Like if depression is related to vitamin B12 deficiency or folate deficiency or vitamin D deficiency, so it's better to treat it first. If depression goes away, it's good. If it does not go away, then you can talk about medication or counseling. Environmental factors also cause depression, like relationship problems, financial problems, losing a job, retirement itself can cause depression. Divorce, and even moving to a place where you are very excited to move, still it can cause depression. Different personality traits or personality disorder can also cause depression. Trauma cause depression. People who have gone through physical abuse, emotional abuse, or sexual abuse, they are more prone to develop depression in their life. People who have substance use disorder or who drinks excessive alcohol can also develop depression. A lot of time I have seen people who have depression and they are drinking alcohol excessively to calm their depression or calm their anxiety. Sometimes I feel that sometimes people self-medicate themselves using different drugs or excessively drinking alcohol. So it's always better to rule that out. If it's alcohol or substance that are causing depression, or it's the depression that is causing people to drink excessively alcohol or using drugs. The main thing is person has to stop drinking alcohol if they are drinking excessively, and stop using drugs, and then they will have a better idea if the depression is due to substance or not. Because once they will stop the substance, if the depression gets better, it means it was more related to the substance use. If the depression does not get better, it means that they need counseling or medication or some other modality to help with the depression. I also feel that people are at risk of depression if they have poor communication skills, because they get frustrated, they have hard time communicating, and that affects their relationship with their families, even at work. Poor negotiation skills can also cause depression, and interpersonal skills problem can also cause depression. I've also seen sometimes people have time management problems, and they are always on a run. They get stressed out because they are not doing the projects on time, and they are not managing their time, and that itself can lead to stress and eventually to depression. So thank you very much for watching. Please let us know if you would like us to create a video on any specific topic. Don't forget to subscribe to the channel, and also let us know what you think in the comments below. Thank you.